Good morning, this is Jenny Harris, and she's a registered dental hygienist. Jenny, could you tell us what a hygienist is?
Very good. A dental hygienist is a dental professional that helps patients take care of diseases and also maintain a healthy mouth.
Okay. And what could people do to keep a healthy mouth? What are some things that you would recommend them to do?
Yes, it's not one easy question. There's several things that involve a healthy mouth. It has to be with genetics, with nutrition, how well you take care of your teeth at home, and how often you come and visit your dental professional, your dentist, how often you get your regular cleanings.
What would the patient expect when they come in to see you? What do you normally do for people, and how does it benefit them?
Very good. The first thing that we do is welcome our patients and review the health history, make sure everything's okay overall. Then we take a look at their mouth and we check for any abnormal things that they might have, or if everything looks good, then we proceed picking up our instruments, taking a look at their teeth, their gums. We check the gums, make sure they're not inflamed or red or bleeding. We check the teeth for cavities, and then we proceed with what kind of dental cleaning they need.
Are there different types of dental cleanings?
Absolutely. When there's the absence of disease, patients benefit for what we call a prophylactic cleaning, which is basically cleaning plaque and calculus from above the gum line. If there's food stainings, then we polish, and then we offer a fluoride treatment.
Okay. And could you tell us what diagnostic tools you use, and how does somebody understand that?
Yes. To detect if there's anything wrong with the gums or the teeth, we use several diagnostic tools. One is photography, digital photography. Another one is x-rays like we have over here. And of course our instrumentation, we use the probe to determine how the gums, if they're healthy or not. We measure the gums basically.
And how can you explain the measuring of gums with the periodontal probe to a patient? What does that mean to them, and how does that affect them?
Very good. A healthy pocket has a small measurement of 2 millimeters. How deep the instrument drops from the tissue down to the base of that pocket. If it's a low number, 2 or 3, that's excellent, that's healthy. But if the probe drops into the pocket 4 millimeters or deeper, then of course that's a sign of disease.
Could you talk to us about bone loss and how x-rays help you in that? And how do you determine that with the periodontal probe and x-rays to determine how their gum condition is?
Again, if the tissue and the tissue that surrounds the teeth are compromised, then we're going to experience deeper pockets and bone loss. If we look at the x-ray over here, we have the tooth and this void of dark areas. Those needed to be filled with bone. That's a compromised tooth right there with bone loss. It shows on the x-rays. Then the tooth loses support, and then it becomes loose, and inevitably it has to be removed if nothing is done about it.
Are there ways of reversing gum disease, or handling? How do you handle gum disease?
If it's mostly little bone loss or no bone loss and everything is compromised, just the gums inflammation and the disease, the infection is barely starting, the hygienist can handle it with the tools of hand instruments, the satellite unit, or ultrasonic instrumentation, and also laser to disinfect the pocket. If the infection has grown into the bone, then it requires more advanced instrumentation and of course surgery.
Okay. Well, thank you very much.
You're welcome.
And actually, one more question. How do you make patients' visit comfortable? Are there something you could do to help their visit?
Yes, so we have wonderful anesthetics. We can use local anesthetics, either injectable or non-injectable. For people who's afraid of needles, we can do something for them too. And if patients are extremely nervous, we can also use other medications that can make them feel at ease and carefree on the chair.
Well, thank you very much. And I look forward to getting my teeth cleaned.
Of course.
Thank you.